Next up, we have Ann Zenk. She's Vice President of Workforce and Clinical Practice for Wisconsin Hospital Association.
All right, good afternoon. I thank the Evidence-Based Policy Project and SAM for pulling this day together, and I thank Senator Fine and all of you for taking the time to attend this workforce briefing. WHA continuously monitors Wisconsin's healthcare workforce. We watch research, educational efforts, legislative efforts, and we gather information from our members, which are hospitals and health systems across the state. Annually, since 2004, WHA compiles this information into a workforce report. This report includes recommendations for policymakers. Healthcare is really an important public infrastructure, like roads or schools, and it's critical that key stakeholders, like all of us, and policymakers support the changes necessary to address rapidly evolving healthcare workforce needs. When we think about what changes are needed to support and grow the workforce, WHA looks through the lens of practice. So, what can a healthcare professional do based on education, training, and experience? Policy, state statutes and regulations, and payment. What can a health workforce professional practicing within their scope and providing healthcare within statute and regulation get reimbursed for? Healthcare organizations design their care according to these three P's, but sometimes the data and workforce trends show that one of the P's needs to change to promote better care and better utilization of our healthcare workforce. Before we dig into the data, let's set the stage. What's driving workforce supply and demand? Factors driving demand for healthcare include what we've all heard, aging, which brings complex and chronic conditions with it. We also know that more people in Wisconsin have health insurance, and that drives a need for access. Finally, we know consumers are looking for access in a different way, through smartphones, through telemedicine, patient portals, access enhanced by technology. What about supply? Aging and technology also play a key role in supply. We know from Rochelle and previous speaker that physician and provider shortages aren't just looming, they're here. We also see care continuing to move from the inpatient hospital world to outpatient. And finally, the U.S. is working to move from a disease focus to a wellness focus, working to manage population health. So let's talk a little bit about the data. What do we know about the healthcare workforce? Let's walk through a national timeline. We know that in 1990, manufacturing was the leading employer in most states. By 2003, retail trade had taken over. Healthcare employment grew rapidly over the next decade, and by 2015, healthcare was the dominant industry in over half of the United States. In fact, healthcare was projected to lead national employment by 2024. Well, guess what? We didn't make it to 2024. In the last quarter of 2017, healthcare became America's largest employer. With healthcare jobs expected to increase by 30% by 2030, it's vital to support the growth of our healthcare workforce. We know we're already looking at a big gap between hiring and job openings in healthcare. In fact, if you look at the light blue bar next to the healthcare section, that shows separations, people leaving their jobs. The orange bar shows hires. So we know in healthcare that we're just keeping up, hiring is just keeping up with separation, and that there's a huge gap between what we can hire and new job openings, which is that dark blue graph, or dark blue bar. So where are all the openings? WHA's Information Center coordinates the annual Wisconsin Hospital Survey, which includes vacancy rates for hospital professions. It's advanced practice nurses, as we've heard about, certified nursing assistants, physician assistants, surgical techs, and licensed practical nurses have had the top 5 highest vacancy rates in Wisconsin for the past 2 years. Respiratory therapists joined the top 5 last year, tied for 5th with licensed practical nurses. Aging, we've heard about aging. We also collect the percentage of hospital employed professionals over 55. Individuals over 55 might be in the workforce for a decade or more, but this benchmark provides employers and educators with lead time to prepare for retirements. Occupations with a higher percentage of healthcare individuals over 55 will need more people entering the workforce to prepare for future retirements. A third of certified registered nurse anesthetists, a type of advanced practice clinician, and a quarter of advanced practice nurses are older than 55. And as Rochelle said, the runway to them entering practice is longer. So it takes years to build up this segment of the workforce. As a nurse, this slide always makes me pretty happy because nurses are aging well. What that means is that about half of nurses are in the first 20 years of their career and half are in the last 20 years of their career. So we're sustaining the nursing workforce with new members, and we're keeping that experience available to share professional knowledge and history. So as you've heard, some of the trends that policymakers should be aware of are the two important themes of healthcare teams and technology. It's important to think about that when we're making policy decisions. A team model of healthcare distributes the responsibility for patient care among an interdisciplinary team. The team makeup is fluid. It depends on what the patient needs. It can include physician assistants, physical therapists, physicians, dietitians, CNAs, and CMAs. We also know about the primary care shortage. And in a team-based model, that allows clinicians to delegate to non-provider members of the team within the scope of their training, experience, and education. Teams also use technology. For example, medical assistants can use a standard set of instructions approved by your physician to ask you about and schedule your mammogram. Or maybe you even schedule your own through an electronic portal. Fundamental to this team model is that all team members perform at the top of their skill level. We're fortunate to have legislators and regulatory agencies in Wisconsin that listen and interact. This is essential. Ensuring that our healthcare workforce can meet patient needs today and into the future relies on good public policy enacted by Wisconsin lawmakers protecting high quality, high value healthcare for Wisconsin citizens. I'm going to close with some examples and recommendations from WHA's annual workforce report and examples from partnerships between the state, healthcare providers, and educational entities, all through the lens of the 3Ps. So we know we need to attract and retain workers to the healthcare workforce. And with an aging workforce, we need to address physician and advanced practice clinician shortages now. So in 2013, WHA hospitals, urged by WHA, hospitals and health systems, educational institutions, and health associations like WCMU and the Medical Society of Wisconsin, policymakers created a matching grant opportunity to grow our own physicians. Data shows that 86% of people who attend medical school in Wisconsin complete their residency in Wisconsin, stay in Wisconsin, and practice as a physician. We also know that the 86% drops by 30% if future physicians leave the state for their residency. So the great news is that the Grow Our Own strategy worked. Policymakers' investment and partnerships with Wisconsin's healthcare organizations and medical schools have created 76 more residency slots. That's 76 more physicians in Wisconsin than would otherwise have been available. So in 2017, WHA led efforts with other key stakeholders like WCMU and the Rural Health Co-op to expand the GME program and to create a new program as part of the Rural Wisconsin Initiative. These matching grant partnerships will allow healthcare facilities and educational institutions create the infrastructure necessary to provide training spots and support the training of advanced practice clinicians and allied health professionals like CNAs, CMAs, and respiratory therapists that staff needed to support care in our facilities. Again, remember that key to all of this is that members of the healthcare team can practice at the top of their training and experience. Legislation that Governor Walker signed into law last June is a great example of this. Dental hygienists are an important part of population health and the shift from disease to wellness. And hygienists could already provide preventative care in schools, for example, without the presence of a dentist. With this new law, dental hygienists can support dental health in additional settings, like primary care clinics, nursing homes, and hospitals, taking care to where the patient is. So finally, look at how we can better support teams in technology. Leveraging off licensed clinicians' training and experience is essential in team-based models of care, but we know that regulations don't always keep up with how fast our technology moves or how we use advanced practice clinicians in our settings. So in 2017, WHA helped advance legislation that made clear that advanced practice clinicians can provide care and submit billing to Medicaid without a physician's co-signature. This was already accepted and recognized practice. And it doesn't seem like such a big deal until you're setting up your electronic health records to support billing to Medicaid. And so we wanted to make sure that it was very clear that this was allowed, and we got that law changed. So when policymakers think about supporting technology so that technology can support the workforce, I think this quit working. Oh, there it went. Sorry, just need to pick it up. So when policymakers think about supporting technology so that technology can support the workforce, for instance, telemedicine, smartphones, all those things we've heard about, it's important that reimbursement and practice rules evolve also. And of course, none of that technology exists without broadband access. So policymakers should give funding priority to underserved healthcare areas where technology can be used to maximize the available healthcare workforce. I thank you for your time today, and I hope I have given you some food for thought.